Are two new studies now finding that the outbreak in New York, which of course is the worst in the United States, came from Europe, not from China directly. Dr. Anthony Fauci weighing in, giving these studies some credence.
And given the travel and the air traffic from anywhere in Italy, but also particularly northern Italy, it's just not surprising that unfortunately and inadvertently New York was seeded before they really knew what was going on.
Out front now, Viviana Simon, one of the authors of that study. And, Viviana, I suppose to the extent that they were looking anywhere in those early days, they weren't, they would have not been looking at Europe. But I guess just on a very basic level, when people hear this virus, they assume that it's just one virus. Obviously, what you're pointing out here is that there are small differences that enable you to tell if someone got a virus from one place versus another. How is that? How could you determine that it came to New York from Europe primarily?
So the Mount Sinai Health System is the largest healthcare provider in New York City, and we serve a very diverse population across the city's different neighborhoods. And to monitor the viruses and bacteria that cause disease in our patients, we put in place a pathogen surveillance program over the past years so that we can follow and monitor the, for example, influenza or drug-resistant bacteria. So when the first cases were identified in New York City, we were ready to take action and to immediately sequence those viruses. And when more broad diagnostic testing became available, mid of March, we could sequence and obtain information of the viruses that caused those diseases in the many New Yorkers. And
so basically,
go
ahead. So it's mutating, I guess, over time, not in any way that changes how it affects people, but it mutates enough so that you can tell where it came from?
Yeah, exactly. So we can compare the sequences from the New Yorkers we analyzed with the sequences deposited in a database from all the worldwide analyzed coronaviruses, and we can compare based on those mutations in the viruses. And we noticed, to our surprise, that many of the viruses in New York City resembled the viruses found in Europe.
And from Europe generally, or Italy specifically, are you able to look at it that granularly?
So at this No, we don't have enough data yet, so future studies will provide more information so that we can see from where the virus came.
I know obviously we know Washington State, you obviously had a lot of travel from Asia there, but you have a lot of travel from Asia to the United States as well, obviously, as from Europe. But were you surprised when you saw this, that sort of it seems essentially really first gone to Europe before it came to New York?
So, yeah, we were yes and no. So, yes, we were surprised by the number of viruses that were interrelated with the viruses circulating in Europe. No, we were not surprised because there is really a lot of travel for tourists going forth and back, and New Yorkers also traveling to Europe. And so, in a way, it was not surprising, but the extent of it was unexpected.